for those of you guys who are new to our Go Live session, my name is Tamana, or Tamana, however you want to say it, and I'm one of the contributors of PodMed Adventures along with Shalvi and Jonathan. And we are actually doing a series of Go Live sessions. So I'm a third year podiatry student, just completed my board exam. So for everybody who just took their board exam, congratulations. It was the most nerve-wracking exam I've ever taken in my entire life. So I'm curious about the results. It's gonna come out on July 29th. So I'm nervous and also excited about it. So again, like the next step for us is going to be after board exam, it's going to be applying for externships. So again, like I feel like all of us feel a little lost when it comes to this process. Like I don't know where to start, how to do anything, or where should I research, what information should I be collecting. So keeping that in mind, what we're trying to do is that we're holding a long session of several Go Lives, which is called Exploring Externships. Our first session was about how COVID-19 has impacted different externship programs. The second one was about how to create your CV. Dr. Darsh Shah has done a wonderful job about giving us advice about what to include in your CV, what to not include, how to create it, so things like that. So if you guys want to check that out, we have it on our YouTube channel. You definitely need a pen and paper because he gives so many good advice. You definitely want to jot it down and keep that in mind as you're working on your CV. So just based on that series that we're doing, today's is going to be about how you're going to make a list about different externships and how to choose different externships. Dr. Jeffery Zimmerman is going to be talking about it. I will invite him in just a second, but before we do that, I just wanted to tell you guys about this awesome page called podiatrytown.com. So those of you guys who've been pre-med, you guys know about studentnetwork.com. A lot of us get a lot of the information from that. So for podiatry, there isn't anything like that. So this podiatrytown.com has created a community for that. So it talks about all different kinds of things, and most specifically right now I think it's so important for us to figure out where to do externships and learn information about externships. For those of you guys who are completing externships at various places, it would be so awesome if you guys could please write your experience on podiatrytown.com. That way it's going to help so many of us who are so very confused about where to start and things like that. Another thing is, I don't know if you guys know about our apparels. Those are really cute shirts, and what we're gonna do is that as soon as we hit 2K followers, we are going to give out a free t-shirt of your choice to 3 followers that we have. Also, if you want free shipping for your shirt, you can use the code FREESHIP. And the website, somebody I saw was asking, it's called podiatrytown.com. We'll also have it on our stories, so you can check it out. So without further ado, I will go ahead and invite our guest of honor today. Hello.
Anna, how are you doing?
Good, how are you?
Good, good. It's getting a little darker here on the East Coast, so I'm trying to get some lighting in here.
It's fine, it looks great here. So, guys, this is Dr. Jeffery Zimmerman. He's our guest of honor today. He is going to tell us and make us feel so much better after this session, so I'm really looking forward to this as well. So, Dr. Zimmerman, tell us a little bit about how you got into podiatry.
Sure. So first of all, congratulations on finishing your boards. That's always a great feat, and for all you others out there that finish it, congratulations. One step closer to not your final destination, but getting closer. So, sorry, what was the question again?
How did you, I know we all get lost.
Yeah.
How did you choose podiatry? Like, it's such a, I mean, not a lot of people know about it, so what was your path?
Yeah, so I got involved with podiatry originally going pre-med. in my undergrad. I went to a small liberal arts college here in Pennsylvania. And through I believe it was through my junior year, a podiatrist from a local program, actually, a residency program, came to talk at my college, and it was his first time going there. And he had a lot of great things to discuss as far as what things you can do, what kind of lifestyle you can have. And it piqued my interest enough to go shadow him. And after my first day, I then asked for another day and then another day. And before I knew it, I was 2 weeks shadowing him and realized how much I loved the profession based off of the lifestyle, what he was doing in his clinic, the surgeries he was doing. So, I took that jump and started the application process, and then the rest was history.
That's awesome. I feel like that's such a common theme. It's just getting the word out there. I think that's where it comes down to. It's like if you can just get a pre-med student in a podiatrist's office, they're sold. That's
and honestly, I mean, perfect example is your platform. You guys are on social media to be able to promote the profession inadvertently. You're helping out podiatry students, but you're also being able to put us up there to let students know that this is an option for them. And it's such a great thing that you guys are doing. I'm really excited for you guys.
Thank you. Yeah, I think that was our thought process as well, is that, like we didn't know about it, and it just feels like it's such a shame that people don't know about podiatry. So
absolutely.
That was the reason we started. So where did you go to school?
So I did my training at Temple, and that was all 4 years there. And in my third year, I knew I kind of wanted to stay in Pennsylvania. So leading in maybe to the next question is that as far as externships, I ended up staying in the Pennsylvania area for most of my externships, but I did go to other states to see a couple others.
Other places as well.
Yeah.
Okay. So what year did you graduate? I'm sorry, I think I missed it.
Yeah, so I graduated in 2017.
Okay.
Yeah.
So you just finished your residency?
Yes. So I just finished residency just a couple weeks ago, and I was fortunate enough, and I'll get into this a little bit later in the talk, but when you're looking at externships, I am the type of person that thinks 5 to 10 years ahead. Yeah. And I knew I wanted to be practicing in this geographical area and kind of set my roots down. So I was fortunate enough to be offered a job throughout my 3 years with my residency director, and it was all good. It was just great. It worked out very nicely, but I secured a job early in my third year, end of my second year, and my first official day working will be tomorrow morning at 8 a.m.
Oh, wow. Congratulations. That's exciting.
Yeah, thank you.
Great segue to your first birthday.
Yeah, absolutely. I technically had a surgery last Tuesday. This is one of a great thing to think about. It's a good example, but I had created a good relationship with some of the hospitalists at the hospital, and I got a phone call 2 weeks ago saying that, hey, this cardiologist that I'm friends with, his son just had a fracture, and like, I trust your care, like, would you see him? And that afternoon I was seeing him in the office. I was fortunate enough that all my insurances were already completed, even though my start date's tomorrow. Yeah. And I was able to see him, and I booked him for surgery last Tuesday, and I did a Jones fracture. So that was my very first surgery at the ending. It was awesome.
You already got your first solo surgery.
Yeah. Really cool. Started. Yeah.
Okay, so take us back to you as a third year.
Yeah.
How did you start the process, and give us a little overview of like what this whole externship process is?
Sure. So obviously I had my months already lined up. At that time at Temple, you were only allowed 5 months to extern at programs. So I was very specific about where I wanted to go, and I had kind of a hiccup, and I don't recommend this unless you're truly invested in that program, but I ended up dropping a program because at the time Reading was only about 5 years new, and they didn't have an externship program yet until my year in 2016. So I ended up dropping an externship to replace them for the month of September, and it was like the best decision that I've ever made, obviously, because that's where I ended up going. But um, it was going into it, I I treat everything very similarly. So when I started school, I thought to myself, I'm studying to treat a patient, so I want to be able to treat the patient with the best amount of care or the best amount of knowledge that I have.
Yeah.
So I treated that with externships. I was reading the Crozier manual, all those sources that are out there in order to hit the ground running right away and make a really big impression with my first externship. And the first externship I went to, they were a little bit more academic with questions, which was great. And it tested my knowledge, and um, going with an open mindset, working as hard as possible, and being open and courteous, humble, all those things, working hard, studying, answering questions. If you didn't know an answer, you said, I don't know, those sorts of things, the old mantra. But that was my mindset going into all externships.
Right.
But then when it came time to actually considering them, I try to be as organized as possible, or to be able to objectively define things as much as possible so I can compare them, so that at the end of the day I can, instead of being disorganized and like, well, this place kind of had this and this place kind of had that. No, I wanted to be like, okay, this is my question, or this is my criteria. Did those programs meet those criteria? And that's kind of how I went into those programs.
So what was in your criteria? What was on your list that you were looking for? Like, what was your top priority and so on?
Yeah. So overall, and I'll share this document with you guys if you want to share it later on. Sorry, I didn't have it ready for you guys prior to, but when I considered the programs, I wanted to define the program for myself subjectively and objectively, having objective findings, and we can go through some if you're okay with that.
Yeah.
And then after going through those, I turned them into pros and cons. So, having call 120 days out of the year was a pro for me, because I wanted to be on that much call as a first year, because I got to see so much pathology, which made me comfortable for the second and third year.
Right.
So we can start with objectives. So just to name a few, and if this is getting a little lengthy, you just cut me off.
No. I mean, like, this information is so useful for us. You can go on forever if you
want. So objectively, I, of course, needed to measure it for myself and needed to know what the best place was for me. So first off, I started with a 3 and 4 year program, which still exists. So that is definitely something to consider objectively, to be able to get a straight answer from the program. What is that 4th year benefit? Because if you're considering a fellowship, or if you are trying to be able to maximize the amount of, be able to get the correct training, but also be able to get into the workplace sooner, that's definitely something to consider. And that was my mindset. And then go ahead.
Is it something that, like, programs that have 4 years residency, is a fellowship included in that 4 year residency?
No, it is not. So there are still some programs that exist out there that are for your forefoot and rear foot ankle reconstructive qualification, that 3 year standard. There are some programs that are 4 years, but are just only getting that criteria.
Okay, gotcha.
Yeah.
What else did you look at?
Yeah, so I also want to look at, well, what type of cases are you doing each postgraduate year? And is that system tiered? So as a first year, are you doing more in-house cases, more rear foot, more forefoot? What exactly does that entail? If you're on call, are you the one who is doing those procedures that come in, say if a trauma comes in? Or does the program have a system set up that an upper year would come in for any traumas that get called in? As far as my case, and what I preferred is when you were on call, you were on call. So whatever came through that was yours. And we actually had a clinic at our program that was every Tuesday, Thursday afternoon. And if you saw a patient in there and you worked it up preoperatively, whether it be an ankle fusion versus a bunion, as long as you're on service, that's the case that you're doing. So when I was a first year, I was doing some fun cases, subtalar joint fusion, metatarsal fractures, because I worked those patients up in the clinic, but you got to see it through. And then the beauty of it is you get to see it post-operatively. So you get to see it full circle. So that was another objective finding is, do they have a clinic? And then what type of clinic is it? Are you out in the doctor's offices, or are you in a resident-run clinic with just an oversight attending? And our attendings rotate through this clinic. There's 20 attendings that will now graduated, but that's kind of how that worked.
Is that information readily available somewhere?
It may not be available, but the program should be comfortable enough to tell you what exactly. You would have to reach out to the program in some sort of capacity to most likely find that information out. Or you talk to upper years who have gone through those programs and kind of ask them what they found.
Okay, yeah.
Yeah. So some of the other things were the cases themselves. So this is the big thing for me, and this is where it all started, I think, is because we're going into a 3-year residency program to be trained as a surgeon, right? So we're going to be doing surgical cases. I was curious, well, what type of cases are you doing? What level resident are you going to those cases? What percentage of the case is that resident doing? But then on the backside, and this can turn into more subjective, but then what are the quality of the cases? So is the physician teaching you during the procedure, or are they kind of just leaving you do your thing, during the procedure that they expect you to know what you're doing? Those are very important to me, whether it be 25, 50, 75, or 100% of the case. That's very important to appreciate. As a first year, there's always caveats. So as a first year, you might want to consider, well, you're a first year, so you might only be doing 50% of the case. Or you could ask, well, this attending specifically will let you, or will do one case with you. And then for the rest of your first year, you start doing cases. So every attending has a preference, and you get to learn the overall preferences of that program.
So when you talk about like cases, did you have like did you want to specialize in a particular case that you were looking for residency programs?
So what I cared about is that there was enough of rear foot numbers and beyond. So I wanted to make sure that I felt completely comfortable at the end of my 3rd year to do a flat foot reconstruction, to be able to do an ankle fusion, to do an ankle fracture, not in 30 minutes, but be able to be comfortable enough to quickly get that done. Those were like end goals. And through seeing the 3rd years at the program that I was externing at all of them, honestly, all the programs, I felt comfortable with the 3rd years, which will go later when I actually looked at all the programs. It was very difficult to decide, but so that's kind of how I went through. So specifically, though, the best objective finding that I could have had for the surgical portion of your program versus academic or clinical was how many cases was the resident doing per week?
Okay.
And be able to see that week by week and then average it out. And now you get to find out, and let's say there's 2 first years on service. Make sure you get both of their numbers and average those. So now you get to see, what does a PGY1 do? How many cases do they do per week?
Okay.
How many does a PGY2 do per week? And then PGY3s. At our program, we provide a surgical schedule per week to the externs so that they get an appreciation for what cases we're doing. Even if there's 2 externs with us, at least they get to see the overall cases. It stays organized.
Sure.
Yeah. And then for me, that was a great thing because I was able to see then how many cases each year was doing per week, and the numbers were staggering, but they also have to look at the quality.
What type they're doing and things like
Yeah,
that.
exactly. So that was my favorite thing about my list, was trying to figure out what the averages were per week per resident.
So when you said that you wanted to have like good amount of rear foot cases, what is a good amount that you thought was?
So it's a gray scale because you can go to a program where you get to double your rear foot numbers,
Mm-hmm.
and the quality is there. Every case was you're not just doing like a percutaneous tendon Achilles lengthening. You're doing legitimate rear, not that that's not legitimate because it's a lengthening of a tendon, but that's considered a rear foot number versus an ankle fusion. Those are two very different things, so you have to look at that. But if you get high quality, double the amount of rear foot cases that you need to log, that's great. You can also go to a program where there's 3 or 4 times the amount. That does get the quality, but you're getting just a vast majority of pathology. So you want to look at the number. So for me, I was hoping to at least double, if not triple, and I ended up specifically just the rear foot number. The rear foot number for a resident to be certified at the end of it is only 50 cases, so it's actually fairly small.
What was your case number goal?
For rear foot, well, at the end of it, and whoever I've never, every extern that comes through, I give them my numbers. That's another thing that you should always ask for, is what are your numbers? And this is just where we log our cases.
Okay.
So forefoot, rear foot gets broken down into like soft tissue and bony procedures, and you get to see that from the printout. So I was always very transparent with externs when they came through, and I would be more than happy to provide numbers if even someone wants to look at, well, how are they broken down? But
right.
Rear foot, I was able to quadruple my rear foot numbers, but overall my numbers themselves only tripled. So I mean, you have to look at those two things. Sometimes you want to look at subcategories of what you really want to do, but most residents should feel comfortable providing you with their numbers. Maybe concerning if they are more shy showing you numbers. So just something to consider. Yeah.
So is that something that we can get if we just email the programs before applying for those externships? Or we find out when we are at the externship?
Yeah, I would say when you're there, when you're an extern, you can specifically ask them. Usually they should provide it, but you can kindly ask for it. For those prior to, I usually ask just a general question like, do you guys meet your numbers, and how much do you meet your numbers? And usually they'll go into the numbers a little bit more specifically.
Okay.
Yeah.
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 Anything else that you were thinking of?
Well, I'll run through these. I won't elaborate on them, but again, this will be in a document that I'll provide to you guys. But you should really be thinking about, well, how many days are you on call? Well, going back to the attending, so what type of attendings are you working with? What is their background in training? What year did they get trained? Because that'll definitely affect what type of procedures that they do, or have they had post-training. How many days are you on call? How much is call from PGY 1, 2, and 3? I love the fact that at Reading, once you hit December of your 3rd year, you no longer take call. Now, there was a caveat to that this year. Because of COVID, my co-resident and I, we volunteered to take call during COVID to offset the amount of call that everyone was doing. We thought it was a little overwhelming for our first year, so we figured we help out a little bit during that altered schedule. But salary is important. Benefits that are offered, retirement packages. Knowing if it's a level 1 trauma center and emergency department, and are there emergency room residents, that became new for us during my residency, and it worked out great. The ED residents we were had a good relationship with, and got to learn a side of them. Is there an orthopedic department? Is the department contracted, or is it owned by the hospital? Are they employed by the hospital? And do they have residents? So at our institute, there's no ortho residents, but the ortho group was a contracted group, and there were some physicians who were willing to teach and allowing us into the OR and allowing us to do procedures. So, that's definitely something to consider, because it's sometimes nice to get a different perspective on some procedures from the orthopedic group. So that's my list for objective things.
So after you looked into all of those, like, how short or long was your list?
It was pretty long. As far as like answering all those questions.
Yeah. So like, some of the programs obviously met your criteria, some didn't.
Yeah.
So after all of that, like, how long was your list? Was it like 20, 30, more than that?
Oh, as far as programs?
Yeah.
Oh, okay. So I would say, wow. I remember printing out I forget the centralized website that has every program, but I remember printing out close to
.org, I think.
Yeah, I remember printing out 30 programs.
Oh, wow.
And going through each one and kind of like, okay, looking on their website, doing all that. I dwindled it down to about 20. And then when I was able to select my externships, that was even more refined. But I'll be honest with you, when I got done with my externships, I ended up only doing about 8 interviews, which is a little smaller than maybe the average. I would say maybe average is around 10 to 12. But you guys will learn when you do your interviews in your 4th year, you can have up to 18 interviews. And I think that's still the way that it is without spending more money.
So we hear that typically, like, where you extern is where you end up, but people also do much more interviews when time comes around. Okay.
Yeah. So this is a prime example. My 2 junior residents, who are now the chiefs at the residency program, they're very good residents. They did not do an externship with us and interviewed with us, and they had a great interview and they showed interest. That is something that we, at least at our program, we definitely take into consideration. One of our chiefs, he is originally from California, went to a California school, unfortunately didn't hear about our program until late in the game, but spent numerous phone calls with our chief resident at the time. I was a 2nd year, and flew out to see us right before interviews, and that flight's not cheap. So and it's very stressful because it was getting close to the time and taking boards and all these things. So that definitely showed commitment, and now I golf with him. So he's he's a great friend and a good resident. But yeah, don't feel left down if you don't get into an externship, but you're still interested in the program.
So you basically did 5 externships, and then you interviewed with 8 other people. So
yeah.
Or 8 other programs, excuse me.
Right.
So how did you narrow it down to like 5 programs?
It was tough. I had ideas of what I wanted, and honestly, all the programs were unique in their own way. Reading is a very centralized program. It's rural, centralized to one large hospital. Another program down near Philly that I did, it was more of a city program that had great attendings at and good training. Another program that I did, it had multiple hospitals outside. It was more of the suburban setting. And then I went out to out west a little bit, and that was larger hospitals, pretty distant from each other, but the way that they had their rotation set up is that you stay at that location for the month.
Mm-hmm.
So each was very unique and each was a little different. And I think that's what I needed in order to choose the correct program. Yeah, because even, I mean, all training was good at all programs, but there were still some caveats as to what they were doing there.
That's good to know.
Yeah.
I think we have some questions. Let me see if I can get to them. Somebody's asking, why is it important to find out if it's a level 1 trauma center?
So there's different. Yeah, so there's level 1, level 2, level 3. It depends on what their capabilities are and what region they cover. So, for example, with Reading being a level 1 trauma center, it's based off a couple things like having on the back end having residents, having a research curriculum, but by being designated as that, you're getting filtered in from other hospitals in your area. So you're getting more trauma to that area, more poly trauma that comes in, and more well known. Especially if this Reading Hospital is in more of a rural area and has more smaller community hospitals around.
So level 1 is definitely something that we should look into.
Yeah, it's not, I wouldn't say it's the end all be all, but it's definitely another positive for me, a pro for me, if I would go back and look at it again.
Got it.
Yeah.
And somebody else have another question, is that how do you show that you're interested in a program, especially during pandemic, where most are canceling their rotation or limiting visitation to the program?
Yeah,
It's not an option, I guess.
Yeah, that's a very difficult question. We've had students reach out to us, and I've actually gone on phone calls to at least talk about our program to them. And something that I hope moving forward is that we're able to have maybe some more like either events or webinars to be able to just present the program so that the students have a chance to get to know the programs a little bit more. But we do have a prefabbed PowerPoint that we do present to externs that come through. And I've also talked to a few students over phone with the PowerPoint to be able to get them to appreciate what our program's about and kind of walk them through what a day would be like at our program.
Got it. Somebody else is asking, Bobby Durr, in your current position, are you taking calls? But you're done with your residency now, right?
I am. If it is in regards to during COVID, we were still taking call during COVID as a resident. And I will be taking call as an attending, being involved. So the residency obviously is in Reading where I'll be practicing, so I'll still be involved with the residency group. But my wife and I are actually, well, my wife is pregnant, but we're going to be having
congratulations.
Thank you. We're going to be having a baby here pretty soon. So my employer was so kind enough to keep me off a call for just a few weeks until baby has been here for a few weeks, so that I have time with the boy or girl. We're waiting to find out the sex. So.
Oh wow. So
yeah.
You guys didn't want to check or wanted to know.
No, we're leaving into a big surprise.
That's gonna be awesome.
Yeah, we're super excited. Yeah.
The only caveat is that you can't really paint the baby room, I guess.
No, and honestly, I don't know if I would have if I knew. I think we keep it pretty simple.
Simple.
Yeah.
So many exciting things going on in your life.
Yeah, it's been a crazy summer. I didn't expect COVID to happen, and then graduate residency, start a job, have a baby. A lot of great
things are happening so fast. That's
cool. It's all great stuff.
Well, despite that, thank you for coming on here and
making
time for us. This information is so helpful.
Yeah. And if I may, in the document there will be a subjective section too. So there's a bunch of like subjective things that you might want to think about as well when you make your pros and cons list for each program.
Yeah, for sure. And I will also post this video on our YouTube channel, so people can look into that as well. And I'm very excited about your document. I have so much homework to do, especially after this session. I was like, oh Lord, trying to take notes as I'm talking. I was like, oh God.
It'll be fine. I'm sure you'll do great.
Hopefully. Fingers crossed.
Yeah.
Thank you so much for coming, and congratulations and good luck.
Thank you so much. You guys have a great day.
You too. Bye-bye.
Bye.